into Medicare. By the way, we can include a prescription program if we need to improve it. But the idea of cutting $716 billion from Medicare to be able to balance the additional cost of Obamacare is, in my opinion, a mistake. And with regards to young people coming along, I've got proposals to make sure Medicare and Social Security are there for them without any question.
This is Democracy Now! Expanding the debate with the third-party presidential candidates, Rocky Anderson and Jill Stein. Jim, Lehrer has just asked about Social Security and the so-called entitlements. Dr. Jill Stein.
Yes, I think first it's very important to point out that while we hear a very different narrative from Barack Obama and the Democrats than we do from Mitt Romney, with Mitt Romney's narrative being usually harsh, scary, selfishness on steroids, and the Democratic narrative being warm and fuzzy and we're all in this together, let's just wait for things to get better. You know, it's really important to look beyond the talk, to look at the walk, to look at what's actually being proposed. And Jeffrey Sachs at the University of Columbia has pointed out in his analysis of the budget proposals of both Obama and of Romney-Ryan, points out that they're both aiming for essentially the same targets. They're both aiming for Social Security to be about 5% of GDP some years down the line, whether it's 4 or 8 years. And on Medicare, they're both aiming for Medicare to be reduced to about 3.2% of GDP. So the point is, while they have different scenarios, they both have the same targets. Obama himself is also looking to cut non-security discretionary expenditures, things like that cover education and housing and job training, also looking to cut that nearly in half, according to his own budget figures, down to about 1.8% of GDP from 3.2% where it is right now. On Social Security, Obama is already calling for some cuts, basically to the cost of living reimbursements. So heads up about what's going to happen after the election. You will see the walk differ from the talk. And on Medicare, yes, it is true they are both proposing the same changes. Again, a sign that things are really not different between these two corporate-sponsored candidates. They're both proposing about $700 billion in Medicare cuts. We can fix this. For Social Security, we simply need to raise the cap on Social Security. It will be perfectly solvent when the rich are paying their fair share. And on Medicare, one thing we can do right now is to fix Medicare Part D so that it's no longer a boondoggle, a giveaway for pharmaceutical companies, and to allow bargaining and negotiation to get bulk purchasing and bring down the cost.
Rocky Anderson, you have 2 minutes.
Thank you. The solution to Medicare is to provide Medicare for everybody, to make it a single-payer system. You look around the world, Canada, Taiwan did a study. They looked at all other nations' systems, and they incorporated the very best elements. And they have a single-payer, basically Medicare for all system. And we are paying more than double the average of the rest of the industrialized world per capita for our health care costs. A large part of that is because we're relying upon the for-profit insurance industry to provide health care for most of the people in this country. We need to get rid of that. We can control costs in all of these systems. And by the way, there's not another nation in the industrialized world that does it anywhere like we do, that has the waste, that has the poor medical outcomes, and where people are taking out bankruptcy by the hundreds of thousands. So that is the solution for Medicare. We can make it affordable, we can provide better services, and we can do it for all. You just get the for-profit insurance companies out of the way, and all of the burdensome paperwork and the different billing systems and all the rest that end up costing over a third of what we pay for what's supposed to go toward our medical care. As to Social Security, the Social Security payroll tax is as regressive a tax known to mankind, because if you make $110,000, you don't pay anything on the income over that amount. Everybody pays the same thing up to that point. We need to lift that cap. You could reduce the percentage that workers pay. You could bring it down to 4%. so that the middle class and the working poor come out ahead. You lift the cap, and then you also have those who make their money through investments pay their fair share as well. There's no reason why working people are paying towards Social Security and those who are living off their investments get away once again without paying their fair share.
Back to presidential debate moderator Jim Lehrer.
Mr. President.